Hey everyone, it's time to get your NCLEX game on. Welcome to 15 essential NCLEX questions you need to know. I'm your host from NCLEX Navigator, and today, I'm bringing you some must-know questions to help you ace that exam. Now let's dive right in. Question 1. A nurse is caring for a patient with congestive heart failure experiencing shortness of breath. What should the nurse do first? A. Elevate the head of the bed. B. Administer prescribed diuretics. C. Check the patient's oxygen saturation. D. Notify the healthcare provider. Question 2. A client with type 1 diabetes mellitus reports feeling dizzy, shaky, and sweaty. What's the nurse's priority action? A. Check the client's blood glucose level. B. Administer insulin. C. Offer a glass of water. D. Call the healthcare provider. Question 3. A patient is receiving IV heparin therapy for a deep vein thrombosis. Which lab value should the nurse monitor closely? A. Hemoglobin. B. Platelet count. C. Activated partial thromboplastin time, APTT. D. Blood glucose. Question 4. The nurse is caring for a patient with pneumonia. Which assessment finding requires immediate intervention? A. Fever of 101 degrees Fahrenheit, 38.3 degrees Celsius. B. Respiratory rate of 28 breaths per minute. C. Yellow-tinged sputum. D. White blood cell count of 12,000 mm3. Question 5. A nurse is teaching a client about taking furosemide, Lasix. Which statement by the client indicates a need for further teaching? A. I should eat more potassium-rich foods. B. I will take this medication in the morning. C. I don't need to monitor my blood pressure at home. D. I may feel dizzy when I stand up quickly. Question 6. A nurse is caring for a child with epiglottitis. What's the priority nursing intervention? A. Assess the child's throat using a tongue depressor. B. Keep the child in a sitting position and provide oxygen. C. Encourage fluids to keep the throat moist. D. Give prescribed antibiotics immediately. Question 7. A nurse is providing discharge teaching to a client with warfarin, Coumadin therapy. Which statement indicates proper understanding? A. I will take ibuprofen for headaches. B. I need to eat more green leafy vegetables. C. I will use an electric razor for shaving. D. I should stop taking the medication if I have a nosebleed. Question 8. A patient with end-stage renal disease is on hemodialysis. Which lab result should be reported immediately? A. Potassium level of 6.2 mg/Lb, hemoglobin of 10.8 gdlc, calcium level of 9.2 mg/dld, blood urea nitrogen, BUN, of 45 mg/dl. Question 9. A nurse is administering digoxin, Lanoxin. Which finding should prompt the nurse to hold the medication? A. Heart rate of 52 bpm. B. Blood pressure of 110/70 mmHg. Serum potassium of 4.0 mg/LD. Complaints of nausea and vomiting. Alright, let's check your answers. 1A. Elevate the head of the bed. Improves lung expansion and oxygenation in CHF. 2A. Check the client's blood glucose level. Always assess first before intervention. 3C. APTT heparin affects coagulation and APTT monitors therapeutic levels. 4B. Respiratory rate of 28 indicates respiratory distress. 5C. I don't need to monitor my blood pressure at home. Furosemide can cause hypotension. 6B. Keep the child in a sitting position and provide oxygen. Avoid using a tongue depressor, which can worsen airway obstruction. 7C. I will use an electric razor for shaving. Reduces bleeding risk while on warfarin. 8A. Potassium level of 6.2 mg/L. Hyperkalemia is life-threatening in renal patients. 9A. Heart rate of 52 bpm. Hold digoxin if HR is below 60 bpm. So, how'd you do? Comment your score below. If you found this helpful, hit that like button, subscribe, and click the bell icon for more NCLEX practice questions. Would you like more of these? Let me know, and I'll drop another challenge soon. Thanks for watching, and good luck on